My name is Jared Burton. I am a master's student at WVU. I'm currently a graduate assistant strength conditioning coach for the female track and field team and the cross-country team here at WVU. I also get to work with our rowing team as their strength conditioning coach. I want to talk for a while about lower back issues and their relationship to strength training, considerations for the risk of lower back issues, and prevention methods in athletes. During the discussion of lower back injuries and lower back pain, we'll talk about the role of the lower back, particularly in athletics, and why this is important to properly develop this part of our body. Talk about some issues that can occur with this part of our body, from lack of development to muscle deficiencies, traumatic events, and then what to do with these athletes after a lower back injury occurs or they start to suffer from lower back pain. We'll talk about some commonly accepted treatment practices and potentially some methods that a coach could implement to prevent these injuries from happening. Finally, where is the strength coach's role in all this? Where does he or she fit in? How can he help their athletes once they sustain a lower back injury? Lower back injuries have become quite a problem in today's society. According to Hodder, in 2016, they found that there were 539 million cases reported globally. Now, naturally, this was in the general population, but Green et al. In 2001 said that anywhere from 5 to 15% of injuries reported by athletes across several sports are related to low back pain of some sort or a lower back injury. This seems like a pretty high rate and such a common occurrence in such a prominent area of the body that it requires some investigation and hopefully some consideration how to prevent this from happening or how to properly take care of it when it does happen. When we're talking about the lower back, we're first and foremost talking about a stabilization system. The main mechanical function of the spinal system is to allow movement between body parts, protect the spine, and carry the loads. Punjabi describes this system as three subsystems: the passive spinal column, which includes the vertebrae, disc, and joint capsules; the spinal muscles, which are comprised of the muscles and tendons surrounding the spinal column; and the neural control unit, which sends messages from the brain to these spinal muscles to cause activation and regulation in order to support the spine regardless of the load that it might be under. When talking about athletics, we're talking about the transference of force, which means an athlete is creating force pushed into the ground, and that force is somehow getting through their body, allowing them to move from one place to another. According to the kinetic chain or link theory, the ankles, knees, and hips act as a link system, making possible the transmission of forces into the pelvis and spine during movements such as running, jumping, and throwing. Because the lower back plays such a vital role in the movement of any kind, particularly in sport, injury to this area can have a catastrophic effect on an athlete's ability to participate and compete. Issues occur with the lower back. One of those three systems is not operating appropriately. When this happens, the other two systems will try to compensate for that. However, their compensation can only handle so much of a load before they start to break down as well. A breakdown in the structural area will exhibit itself in herniated discs, stress fractures, or degenerative conditions. However, we're going to focus more on the soft tissue issues, which are muscle strains, ligament sprains. Because of the multiple degrees of freedom in the lower back, the motor control for stabilization is extremely complex. Therefore, lower back injuries can also occur from inappropriate motor control responses by the trunk musculature or inadequate stabilization prior to the sudden loading. Deficiencies in musculature may also necessitate the overuse of other muscles to compensate, and this can result in injury, as we previously said. Injuries are often classified into two groups: acute and chronic. Acute injuries are described by Lavelle and Baum as rapid onset secondary to traumatic events and can account for 60 to 75% of lower back problems. Stone states that these injuries often occur when an athlete loses concentration during an exercise, attempts to perform beyond his or her capabilities, or receives poor coaching instruction during the exercise. Chronic injuries, however, often result of repetitive stress placed on tissue that has insufficient time to recover. They're often a result of overuse or returning to training too soon after an injury. This is a list of commonly accepted potential causes of lower back pain. However, the literature only supports a few of them and still remains fairly unclear. In 1998, 99, and 2000, Scott Nadler got to work with some Division I college athletes and produced a series of studies. Those studies revealed that there was no relationship between leg discrepancy, leg length discrepancy, and lower extremity inflexibility related to lower back pain. However, he did find some connections with poor endurance, altered firing rates, and a deficiency in the musculature, particularly with the gluteus medius and gluteus maximus involved with flexion and extension of the lower back. When an athlete deals with lower back pain, oftentimes they will compensate for other muscles to make up for the deficiency in that area. This compensation can lead to deconditioning of those muscles, which must be addressed when they return to training. There's also some evidence from Radbold and Klawicki in 2000 that the activation of muscles is delayed or prolonged after a bout of lower back pain. This is similar to when an athlete returns from ACL issues or ankle sprains and is hesitant to use that area of their body. This may lead to, this may suggest that there is a lack of full recovery from the neuromuscular system as well. Typically, an athlete's lower spine performs demanding and extreme tasks without problems. However, when an athlete does suffer an injury in this area, it often results in a loss of time training and or competing depending on that time of year in the sport. Up to 30% of college football players, 38% of tennis players, 37% of soccer players, and 90% of golfers, just to name a few, have reported missing time due to neck or back injuries, according to Bono in 2004. There are also gender factors to consider, as Nadler reported in 98, according to the NCAA injury surveillance data, that females are almost twice as likely to suffer lower back injuries or lower back pain compared to their male counterparts. One of the more alarming statistics, according to Green et al. In 2001, is that once an athlete suffers lower back pain or a lower back injury, they are 3 to 6 times more likely to suffer another incident in their career. As strength conditioning professionals, or as coaches in general, what are we supposed to do as far as helping them prevent these injuries from occurring, particularly with such a high rate of reoccurrence, or helping them return from this type of injury when they do happen? There are a decent number of commonly accepted treatment regimens for lower back pain or lower back injuries. Whenever suffering lower back issue, many practitioners recommend a short period of rest, and intervals of icing, followed by progressive stretching, possibly by a trainer. Still, others believe the best treatment for this type of injury is the prescription of anti-inflammatories and exercise. A common requirement, regardless of treatment, however, is the athlete be nearly pain-free with normal flexibility and endurance before resuming normal training. Unfortunately, there is no consensus within the literature with regards to rest, specific rehab, or criteria for return once an injury occurs. Or still, Hodder tells us that the guidelines that are recommended within the literature are not implemented in routine clinical practice, even though there have been a few models that have been detailed. So as a strength and conditioning coach, what is our role when we have an athlete that suffers from a lower back injury or is suffering from lower back pain but is returning to training? Strength training is often viewed as a setting where lower back injuries can occur after all. Literature supports resistance training as an effective method for improving lower back problems. However, there is concern attached to it. As discussed before, injuries of this nature often occur from supporting a load greater than he or she is capable of. Many of these acute injuries happen during strength training as a result of losing control of the weight during a vulnerable position. While an argument could be made that resistance training is in fact the cause of these injuries and may be unsafe, there is a fair amount of evidence in the literature to the contrary. Several studies, such as Stone in 94, Hamlin in 94, and Levely and Ballum in 2010, have shown the relative safety of resistance training even compared to other sports. While resistance training can certainly be safe and effective, there are some considerations a strength coach should make. Often, injuries that occur during resistance training result from high levels of fatigue, which can cause athletes to lose concentration. When fatigue is high, technically complex exercises should be limited, as performing them in a fatigue state can limit learning and stabilization, according to Stone in '94. As stated earlier, chronic lower back issues often result from overuse of the musculature responsible for stabilization of the spine through the repetitive stress placed on the tissue without sufficient recovery time. To reduce the risk of this, it is imperative that strength coaches educate themselves on proper exercise selection, instruction, and periodization techniques to implement for proper development and safety of the athlete. It is not merely the strength conditioning coach's job to help an athlete return from injury. However, through the use of a properly designed strength conditioning program, they should be able to help that athlete develop stability or the ability to stabilize through training and the participation in sport to allow them to avoid this type of injury. Training enhances the ability to perform complex mechanical tasks. Therefore, learning to use muscles that support stability can be increased, particularly where loads can be anticipated. Understanding the kinetic chain and the ability to transfer force from the ground to the trunk and through the upper extremities, and how this link theory applies to the particular sport that athlete is in, can also guide the strength coach's decision-making when he selects both exercises and training approaches throughout the year. Using the appropriate training implements, such as free weights versus machine weights, is also a necessary consideration, particularly for the athletic population. Lower back injuries can be very frustrating for athletes. Speaking as an athlete that suffered from lower back pain throughout my career, it was very difficult to not know exactly what I was doing that was causing the pain and not be sure what I needed to do in order to recover from it. I felt like going through the process of this research, it would help me to have a clear idea of how they happened and what was needed in order to recover from them. However, the literature remains ambiguous. Things such as flexibility and core strengthening programs, which are commonly accepted as ways to recover from and prevent lower back injuries, are not agreed upon in the literature. While it does give us some direction, I do believe a great deal more investigation is required. Thank you for taking the time to listen to this. Hopefully you learned a bit about lower back injuries and how to handle them. This is a list of the references that were used in this presentation.